Okay, good afternoon, everyone. Today is Monday, December 20th, 2021. We have convened the Board of Health for the New York City Department of Health and Mental Hygiene. It is 1:02 p.m. and it's my privilege to call this meeting to order. As always, to begin, I will conduct roll call. We are expecting a handful of absences today, but we will still have a quorum. So I will say your name and please let me know by saying here. Pamela Breyer, Dr. Sixto Caro, Dr. Joel Foreman.
Here.
Rosa Gil.
Here.
Dr. Sydney Hankerson. Dr. Mitch Katz. Dr. Susan Klitzman.
Here.
Dr. Simona Kwan.
Here.
Ms. Karen Redliner.
Here.
And Dr. Lynn Richardson.
Here.
Thank you so much. We have 7 Board of Health members present, and so that does constitute a quorum for our ability to move forward. With that, let us please move into the approval of the minutes from the November 19th meeting. First, are there any corrections to the minutes from the November 19th meeting? Okay, I don't see any corrections being raised. So since there are none, may I please have a motion to approve the minutes as distributed?
A move. Second.
Thank you. I heard Rosa, and then thank you, Lynn, for the second. All those in favor?
Aye.
Aye.
Aye. Aye.
Thank you. Any opposed? Thank you so much. The minutes from the November 19th meeting are approved as distributed. We have several items on our agenda for today, but before we move into it, I wanted to start just by sharing some framing remarks because they're so important for where we stand, particularly with our situation related to COVID-19. As you're no doubt aware, we have seen a sharp increase in cases in recent days, and this is likely due to the Omicron variant, which was estimated to be at about 13% of our sequence samples last week and is likely to be a significantly higher number compared to that this week. We do expect that it is Omicron primarily that is contributing to the case increase that we're seeing across New York City. And we anticipate further case growth in the coming days and weeks based on the trajectories that we're following from other countries, including South Africa, the United Kingdom, and Denmark. I'll be brief just in describing Omicron in saying that it is the fastest, fittest, and most formidable version of the virus that we have seen thus far, particularly with respect to its rapidity of spread, which is also in part due to its ability to evade the immune system. But we also do know that both our public health precautions help to curb the spread of the virus, and importantly, vaccination remains important to help prevent hospitalizations and severe disease, even though we do have emerging evidence that vaccine effectiveness against infections appears to be reduced. And importantly, preliminary data also does show that booster doses do enhance protection against both infections as well as severe disease. Next slide. I wanted to connect that last point to some of the work of the Board of Health, particularly over the last several months. And I want to start with a note of gratitude for the ways in which you have walked with the health department and the city as a whole on our journey with respect to our COVID response. Here you can see, and hopefully it's able to be read despite some of the small font here. We have made very significant progress in our historic vaccination campaign. As a whole, we're approaching 15 million total doses administered in New York City. And you can see in the top left-hand corner that we have now surpassed 70% of all New York City residents who are fully vaccinated. over 80% of youth 12 to 17 with at least one dose, and 90% of adults with at least one dose. What has contributed to this is what we've talked about in prior board meetings. We started with a particular focus on lowering barriers to access, making vaccination as accessible and available as possible. We've done a huge amount of work to build vaccine confidence across New York City. And this has meant working with community partners, whether they're faith leaders or community-based organizations, to help us get the word out about the benefits of vaccination and also combat the significant misinformation that exists about the COVID-19 vaccines. On top of that, excuse me, we've had some very important additional vaccine policies. First, starting in July, as you can see here, we launched vaccine incentives, which have also helped to increase vaccine uptake. And that was the same timeframe that we began elaborating our vaccine requirements, starting with healthcare workers and school staff and moving to all public employees, as well as other sectors, which we'll discuss today. It is undoubtedly the case that all of that taken together, access, incentives, and requirements as they're needed, have helped us to get to what are remarkably high levels of vaccination, which will be critically important to protect people, again, particularly from severe disease as we head into the Omicron wave. So again, I wanted to particularly call this out because so much of this has involved the Board of Health, and so much of it is related to our vaccine policies and particularly our vaccine requirements over the last few months. With that, allow me to please pass the baton to our wonderful General Counsel, Lisa Landau, who will present on our orders pending ratification. Thank you.
Great. Thank you, Commissioner, and thank you, board members, for joining us today. I'm going to talk a little bit about the vaccine mandates that are before you today for ratification. There are 3 commissioner orders requiring COVID-19 vaccination for those public and charter school students who are participating in high-risk extracurricular activities, vaccination for non-public school staff, and vaccination requirements for private sector employees. Next slide, please. And as the commissioner mentioned in that terrific slide showing the trajectory of vaccination, this is really a laundry list of the mandates thus far, wanting to just share the trajectory just temporally with everyone and kind of bringing you back to the beginning climbing of the ladder, where we were focused on protecting the most vulnerable populations and established a mandate for workers taking care of people in residential and congregate settings. And we moved on to protecting students in our DOE mandate at the end of August in advance of the opening of schools in September. And then just mentioning the commissioner order for all city employees by the end of October, so that we in the city would be walking the walk of vaccination, and with a lot of success that I'll talk about in a moment. And most recently, sort of finishing up the protection of children through a vaccine mandate for childcare and early intervention staff. I want to also say that as we move to the next slide, that not only do we have very, very strong data to show that the mandates work, but we also have been very successful thus far in the attempts to stop the mandates from going forward. Just to mention that to date in New York City, our defense of our mandates has been quite successful. But I think these statistics kind of showcase how effective the mandates have been for just a handful of agencies, including the NYPD, the fire department, and both the firefighters and the EMS group, and with our sanitation workers. These are really impressive increases and really what we were concerned with and wanted to make happen, and we're very pleased with these results. As of mid-December, 94% of the city workforce is vaccinated. So we're very, very happy about that. So starting with our first commissioner order for ratification today is the high-risk extracurricular activities mandate, which will look a little familiar to all of you. So essentially, this is a recasting of a mandate that was ratified back in September for those students ages 12 and up who participate in extracurricular sports and high-risk extracurricular activities. And so not surprisingly, given that in early November, when children ages 5 through 11 became eligible, we decided to ensure that those children participating in these activities would also be required to be vaccinated to be able to participate safely. So the commissioner signed an order on December 10th, essentially bucketing all of the ages into one vaccine mandate to ensure safety for these children who are participating in these high-risk extracurricular activities. Next slide, please. So just the rationale, not surprisingly, wanting to encourage children to participate in activities and do these kinds of sports and enrichment extracurriculars like band and chorus, but wanting them to be able to participate safely. And so really just adhering to the CDC and New York State guidance and putting those into one order. Next slide, please. So the next commissioner order we're discussing and putting before the board is the mandate with respect to non-public school vaccination of staff. On December 2nd, the commissioner signed an order requiring that all non-public school employees provide proof of vaccination against COVID by December 20th, today, or be excluded from their workplaces. And it's just to say that, of course, we had already mandated our public school and charter school staff to be vaccinated back 2 months ago. And so this was not an unexpected next rung in our ladder to ensure safety for students in these schools as well as staff. Next slide, please. We want to protect our students and staff. We want to keep schools open. We want to boost vaccination rates. And again, this order aligns with prior orders regarding educational settings. Next slide, please. And finally, perhaps crescendo into maybe the largest group to date is the private sector vaccine mandate. And this is a mandate that applies to at least 184,000 employers in New York City, climbing the ladder, of course, starting from where we looked early back in the summer, vulnerable populations, Department of Education employees, city employees, and we're really at a point where it makes sense to ensure that employees in the private sector are also required to be vaccinated to protect each other and to protect the public that often they are serving. So December 13th, the commissioner signed an order that requires workers to provide proof of vaccination on December 27th. It includes record keeping requirements and of course provides a pathway to a reasonable accommodation if requested. Here we have an array of businesses and workplaces in New York City where work is performed in the presence of other workers, members of the public, clothing stores, taxi cabs, or rideshare owner operators, speech therapists who visit clients in their homes, writers who rent desks in shared workplaces, just to give you a flavor of the kinds of employees that are covered. And this will begin to be enforced over the course of probably January. with record keeping required and posting requirements indicating that there's compliance with this order. Next slide, please. So obviously in these times, we want to mitigate the risk of COVID transmission. The commissioner, of course, underscored Omicron, and all of us know that the transmissibility is big. We want to make sure the vaccination is everywhere as much as we can to protect people from severe disease and really ensure that we are protected in New York City and ready to deal with what comes before us. So the winter months and Omicron for sure. So the proposals before you with respect to these commissioner orders are, of course, to ratify each of them, the participation in high-risk extracurriculars, commissioner order, the order of the commissioner to require vaccination for non-public school staff, and finally, the order of the commissioner to require COVID vaccination in the workplace. So we're happy to hear questions and then proceed with a vote after we answer any questions you might have. Thank you.
Thank you so much, Lisa. And as always, you can either raise your hand virtually or on the screen. And at this time, we'll take questions. Dr. Foreman.
Thank you, Dr. Chakshi, and thank you, Lisa. That was great. I did have a couple of specific questions. In the final order about private workplace mandates, there are 3 exemptions. One makes plenty of sense to me: an individual who works from their own home and whose employment does not involve interacting in person with coworkers or members of the public. But I had a quick question about the other 2. One is an individual who enters the workplace for a quick and limited purpose. And I apologize if I should know the answer to this, but what are examples of that? And then the last one excludes non-city residents who are performing, and I disagree with that and think they should be required. I would still support this order, but I would like to inquire why we can't change that. I realize it might be in conflict with the Key to NYC program, but I still think that anybody who's coming and performing should be held to the same standards as city residents. Thank you.
Thank you, Dr. Foreman. I'm sorry, Commissioner, go ahead.
No, I was going to just turn it over to you, Lisa. Please go ahead.
Well, I think I'll start with the second first, and I think that that's right. It is key to being consistent with the Key to New York City. That's as much as I can say about that particular exemption, that trying to be consistent is important, but understood, and will certainly pass that comment along. And with respect to the question about individuals who enter workplaces for quick and limited purpose, that might be someone who's delivering something quickly or a repair person. It's really those episodic entries where it's difficult to ensure that someone is vaccinated, for an urgent purpose, for example, or a delivery purpose, less urgent, but still episodic.
Thank you. I would think that would be fairly rare. Most of the people doing deliveries are employees who would fit under this and have to be immunized. I had one last question, which applies to the other orders, or all the orders actually that are that define fully immunized, and that is the department considering changing the definition of fully immunized to include a 3rd shot? I think it's pretty clear that there's a lot of benefits to that, and I suspect that making that fully immunized would also encourage people to get that 3rd shot.
I can take this one. And the short answer, Dr. Foreman, is yes, it is under consideration, both at the city level and also nationally, as I'm sure you're aware. There are, considerations to take into account, and the science is not yet settled, precisely what the difference is between fully vaccinated and with an additional dose, particularly in the context of Omicron. So we're following that very closely. There are certainly, preliminary indications that additional dose will be vitally important, and it will require us to to update the definition, but that is not something that, that is part of the discussion or the vote at this moment today.
Thank you so much.
Great. Are there any other questions? Dr. Richardson?
Yes, thank you. This is really a follow-up to Dr. Foreman's question. And I'm just wondering if all of the previous commissioner orders have the same exemption for non-New York City residents, for example, healthcare workers or teachers, or did I just miss that previously, or is that different somehow now because it's private employers?
No, and I'll start, but Lisa should chime in on this one. There is a major distinction. This is about people who are coming in for a temporary and time-limited purpose, like performance or an athletic event. That's what the exemption in this order is about. But Lisa, could you please elaborate on that?
I don't know that I can say more to that, except to the point of you're correct, Dr. Richardson, that other mandates don't exclude, staff who are non-city residents. And I think, but it loops into the commissioner's point that those are people who are working, every day with students or with the public on behalf of the city, and are deemed different than these temporary spots that people have that are 1 hour, 2 hours. And so a decision was made to distinguish those from others.
Thank you.
Karen Redlander.
Hi, thank you. Just to follow on then on that issue for my own information, I'm not familiar with the details of the Key to New York City statement. So I'm just curious what in that policy is the point that's consistent now with the visiting musicians.
I would just say that continues to be, even though the Key to New York City mayoral order has been updated, that exemption continues to be in effect.
Right,
So,
and Karen, if I understand your question correctly, you're saying, but you understand the consistency point, but why was it put in Key to NYC in the first place? And I think that the answer to that is really about the temporality, in terms of the time frame, in which someone will be in New York City, as well as the ability of New York City government to be able to regulate that.
right, but what is the Key to New York City policy? Let me just what does it apply to? And maybe I should be familiar with this, but I'm not sure what that is. I'm just curious, and how that was established, some benchmark that is now, the comparison, for this population that we're being consistent with.
I'm happy to explain just a little bit of background, and I think a little bit less about it, perhaps because it has been done under the auspices of the mayor's office. It's a mayoral order, but it is the key to being able to enjoy what New York City has to offer. I mean, that was how it was rolled out for museums, for movie theaters, for restaurants. So it was a way to encourage vaccination of the general public in order to glean the benefits of what New York City has to offer. So that was the link, essentially. So it was really about the public accommodations to people out in the world, New York City residents and non-residents, and employees of those establishments as well, full-time employees. So those were the two populations that were, envisioned to be affected by that mandate.
Okay. Thank you.
And I'm happy to provide it to you just so you have it, just in case.
Thanks. I see Dr. Foreman's hand up again.
I'm sorry, thank you. I just wanted to follow up on that just to be clear. It seems to me that the mandate around requiring immunizations to be in these sort of settings is clearly a public health domain that should fall under the Board of Health. And although I understand the desire to be synchronized with a mayoral order, am I correct in stating that we are not obligated to do that?
You are correct.
So I understand the need to synchronize. I think it's really important that there's the same messaging, but I continue to disagree with that piece of the order.
Thank you, Dr. Foreman, and that is certainly noted. Do we have any other questions from board members? Okay, I don't see any further questions. So the way that we will do this is we'll go sequentially through each of the three orders. The first one will be about the high-risk extracurricular activities for students, the second for non-public school staff, and then the third is for private employers. So for each of them, I'll ask for a motion, a second, and then take a vote. So for the first one, may I have a motion to ratify the December 10th order of the commissioner regarding participation in high-risk extracurricular activities?
So moved.
Thank you. And a second?
Second.
Thank you. And I'll go ahead and take a vote from each member who is present. Dr. Joel Foreman?
Yes.
Rosa Gill? Dr. Rosa Gill?
You're on
Sorry,
mute.
yes, yes,
Thank you. And Dr. Susan Klitzman?
yes,
Dr. Simona Kwan?
yes,
Karen Redliner?
Yes.
And Dr. Richardson?
Yes,
Thank you. And I don't see Dr. Katz having joined us yet, but I'll just check to see if he is on. Okay, if not, with a unanimous vote of 7 out of the 11 total board members in favor of the motion, this motion does carry. So we will move to our next order. And so again, I'll ask for a motion to please ratify the December 2nd order of the commissioner to require COVID-19 vaccination for non-public school staff.
so moved.
Thank you. And wonderful. And just going through again, Dr. Joel Foreman,
Yes.
Dr. Rosa Gill,
Yes,
Dr. Susan Klitzman,
yes,
Dr. Simona Kwan,
yes,
Ms. Karen Redliner,
Yes.
and Dr. Lynn Richardson.
yes,
Thank you. Again, with a unanimous vote of all 7 present members, that motion also carries. And then finally, may I have a motion to ratify the December 13th order of the commissioner to require COVID-19 vaccination in the workplace?
so move.
And a second, please.
Second,
Thank you. Dr. Foreman,
Yes.
Dr. Gill,
yes,
Dr. Klitzman,
yes,
Dr. Kwan,
yes,
Ms. Redliner,
Yes.
and Dr. Richardson.
yes,
Thank you. And again, with a unanimous vote of all 7 members present, that motion also carries. Thank you so much. Those continue to be very important steps forward for us with respect to augmenting the level of vaccination in our city. With that, I'm truly excited to transition to the next section of our agenda and to introduce my colleagues, Dr. Torian Easterling and Dr. Michelle Morse here today to share with the board the progress that we've made on our landmark resolution that declares racism a public health crisis. Dr. Easterling, whom you may know, is our first Deputy Commissioner and our inaugural Chief Equity Officer. And Dr. Morse is our Deputy Commissioner for the Center for Health Equity and Community Wellness and our first ever Chief Medical Officer. I'm sincerely grateful to both of them for their leadership on this work, and I'm delighted to turn it over to Dr. Easterling and Dr. Morse.
Thank you so much, Commissioner. And good afternoon to the members of the New York City Board of Health. Really happy to be joining you all this afternoon to provide an update on our Board of Health resolution declaring racism as a public health crisis. I'm going to move forward and just walking through the actions that we committed to, both as an agency and to all of you and our institutional accountability to make sure that these are the things that we're moving forward with. And we'll certainly call on my colleague, Dr. Morris, to also provide updates. And so, as you all know, on October 18th, the New York City Board of Health has passed a resolution declaring this resolution, making sure that the New York City Department of Health is not only naming the injustices that we know exist because of racial injustices, but also committing the agency to specific actions to carry out the work of advancing an equity agenda for this city. We have already listed out the acknowledgement, and I'll just sort of walk through some of the updates that we have committed in this resolution to come back to the board on a semi-annual basis to provide these updates. First, I'll just mention under requesting the health department to expand this work to develop priorities and next steps for racially just recovery from COVID-19 and other actions to address public health crisis in the short and long term. The update here is really speaking to the agency's way of laying out a blueprint for this city to become healthier. We are preparing to launch the next iteration of our Take Care New York plan. And although really speaking to this report, more so wanted to just note how things have changed. And certainly, during this pandemic, we know that we really need to focus more affirmatively on how we're advancing a health equity lens in our neighborhood and also across the life course. We're also using this roadmap to design the ways in which we are transforming our health department and the city at large. And I think the other part, which is different for our Take Care New York plan, is also really baking in the lived experiences of communities. So in the past, we've done our consultations after the Take Care New York plan was developed. We went out and we shared neighborhood profiles. What has changed is that we've already conducted community conversations in all of our priority neighborhoods, the Task Force for Racial Inclusion and Equity neighborhoods. We've conducted several story circles within priority populations, and we are conducting community visioning sessions with key leaders across the city. We've already completed 3 of those visioning story sessions over the last month. And this is a way in which we are embedding into our Take Care New York plan the voices of New Yorkers to make sure that we're laying out how we're coordinating many of these systems and structures that are in place, the steps that we need to take as an agency, and certainly thinking about all of the intersecting factors that lead to healthier New York. And so you can move to the next slide. In addition, the resolution requests that the New York City Health Department research, clarify, and acknowledge examples of historic role in divesting and undervesting in critical community-led health programs and participate in the truth and reconciliation process with communities harmed by these actions when possible. And the update here is that the agency has partnered with several local organizations, city and state agencies, to really assess steps to reinvest in priority communities. One of the ways that we're doing this is working with organizations like Make the Road New York, as well as the Federal Reserve Bank for New York, to really identify these steps. One of those areas is really looking at ways in which we can tackle partnerships around the private sector as well as public health as well to really improve our public health workforce and to address community outcomes. I think this is really important in making sure that we are strengthening our public health infrastructure. I also turn to Dr. Morse to talk more about steps that we're looking at health impacts in key neighborhoods to address the racial wealth gap. Dr. Morse.
Yes, thanks so much, Dr. Easterling. And just briefly, I'll on the prior slide, we'll just add, I'm getting a little lost in the slides, apologies, but essentially a part of the collaboration around understanding the racial wealth gap is really recognizing that in most cases, data that's collected is around income. And we look often at how income connects to and is shaped by health and vice versa. But this specific investigation is really looking beyond income and looking at wealth because there is not enough data on the connection between wealth and health, in large part because it's much harder to collect data about wealth than it is around income. So we are really excited to delve more deeply into that. And excited to work with some of the collaborators and experts from across the nation who have started upon that work. And we are really seeking to deepen it and again, to bring more visibility to it once there are some results from that analysis.
Great. Thank you, Dr. Morse. Just to go back, the other action just to mention is also requesting the health department to establish a data for equity working group to ensure that the agency applies an intersectional anti-racist equity lens to public health data and provide annual guidance. Happy to report that since our last meeting, we have established our data for equity working group led by our deputy commissioner for the Division of Epidemiology. And so in collaboration with my office and Dr. Sharon Gwynn, really laying out ways that we can really embed our guidance on data disaggregation, but also really looking at additional recommendations that we can standardize the ways in which we can make our data more visible, more accessible to our community partners. In addition, also really thinking about ways that we can focus on the areas that we know are really driving racial inequities and injustice around health. And so we look forward to sharing more with you during our next update. In addition, the resolution requested that the New York City Health Department make recommendations on anti-racist health-related New York City Charter revisions to the Mayoral Racial Justice Commission. And we're going to continue to collaborate with the Racial Justice Commission to strategize on health equity-related recommendations. I'll be sharing a little bit more shortly, but wanted to just give you that quick update that we have submitted 17 recommendations to the Racial Justice Commission. In addition, the resolution requested that the New York City Health Department continue collaborations with sister agencies to report on fatalities, injuries, health conditions by race, gender, and other demographics to improve data quality and care. We are in the process of establishing our data memorandum of agreement to receive deaf data related to law enforcement practices. And we're working with the Department of Corrections to establish that memorandum of agreement. This is building off of our work with NYPD, where we already have an established data use agreement, and we just received a tranche of data from NYPD and are beginning to conduct that analysis at this time. Next slide. In addition, the resolution requests that the New York City Health Department, in consultation with relevant community organizations, perform an anti-racism review of the New York City Health Code, identify existing provisions that support systemic and structural racism and bias, recommend new provisions to dismantle systemic and structural racism and bias. Happy to say that we have developed a guidance framework grounded in equity, outlining the steps to conduct an anti-racist review. We're currently conducting a pilot specifically on 2 health codes that pertains to environmental health and school health. And these are going to be key ways that we can expand looking at all of the health codes, but really be able to make some key recommendations on how we can strengthen our process going forward. And so this is not just about how we're looking at our existing health codes, but also how do we reassure our process going forward. And really want to thank our General Counsel, Lisa Landau, for her leadership here, as well as the other deputy commissioners who are leading in this work. In addition, the resolution requests that the New York City Health Department partner with city agencies and relevant organizations consistent with local law 174, executive order 45, on assessments of structural racism within education, policy plans and budgets related to all determinants of health, and make recommendations to mitigate harm within a public health context. And you'll be hearing from Dr. Morris a little bit more about the work to launch the Coalition to End Racism in Clinical Algorithms. Next slide. So I'll turn to Dr. Morris to talk more about CIRCA.
Thanks so much. Yeah, it's really exciting to have been able to work with partners across the city to launch this coalition just last month. Officially, we held the first workshop for the coalition on November 19th, just a few weeks ago. And why does this initiative really link directly into this resolution? Well, first and foremost, unfortunately, there's not enough consciousness across the medical and public health community about how much white supremacy and racism have shaped the clinical algorithms and clinical tools that we use in medical care. And the first really key piece of this coalition is to say, well, we have to all agree and get on the same page about how that history actually to this very day, in fact, sets standards for clinical care through a process called race adjustment in certain clinical algorithms that we use in clinical medicine to this day. And so part of the goal also of this coalition is to bridge the implementation gap. Even though there's rising knowledge about how this happens, how this practice of race adjustment can actually lead to delays in care for people of color. We also have to make sure that across the city, the institutions that are using these algorithms come together to say we collectively have agreed to end this practice. And we're not just going to end it, but we're actually going to look at how ending the practice changes racial inequities in healthcare. So of note, there are 12 members of this coalition, including several of the largest institutions across the city that provide clinical care. Health and Hospitals is a founding member of the coalition because of the work that they've done in this realm to date, which is very exciting to witness and to learn from. And briefly, the 5 main goals of the coalition over the next 2 years are first, as I mentioned, to raise awareness about how race adjustment in clinical algorithms contributes to racial health inequities. The second is to end race adjustment in at least one of 3 priority algorithms within 2 years. The third is to look at institutional and citywide impacts of making those changes and on how they impact racial inequities. The fourth is really elevating and communicating these commitments across these institutions to advance health equity. And then finally, really to do the proactive engagement of patients to make sure that any potential impact race adjustment has had does not actually delay timely care and referrals for people of color, especially Black, Indigenous, Latino, and other groups that are communities of color. The advisory council of this coalition is an incredible group of national and global experts who are researchers who have either led these changes at their institutions or led changes to national or global standards around race adjustment. And the 3 algorithms that the coalition is prioritizing for now are EGFR, which is around kidney function, vaginal birth after cesarean section, which is a calculator that assesses risk for risk for vaginal birth after cesarean. And the third is a lung function test. So we're again very excited that this collaboration that bridges public health and healthcare and seeks to have citywide impact on racial inequities related to these particular algorithms, again, advances the anti-racism commitments in the resolution. Back to you, Dr. Easterly.
Thanks, Dr. Morris. And last but not least, I wanted to circle back to an update on our work to really support the Mayoral Racial Justice Commission, which I must say, I think is really important in the approach that the city has taken to implement a racial justice review and the very structural foundation of the city, the New York City Charter. And this is the way in which government can bend to address racial inequality. One of those ways has been this Mayoral Commission, and then also making permanent the Task Force for Racial Inclusion and Equity. And we've certainly played, as an agency, a strong contribution in moving both of these components forward. As many of you already know, the commission is a 2-year mandate, and year 1 is approaching to an end. We are expecting that the commission to release their final report, as well as their final ballot measures, which is planned to be sent to the Board of Elections in preparation for the November 2022 ballot. And so the ways in which we have supported this process across the agency, we work with staff to really develop recommendations. DOHMH put forward 17 recommendations. And this is built not only the work of the agency in the past year and a half during this response, but years of developing and implementing anti-racism public health practice. The work we have done to really stand up an internal transformation process, really changing the ways in which our strategic plans, our equity goals are really embedded in all the work that we do. And so just to share a few highlights of some of the recommendations that we put forward, really knowing how much language is important, we recommended that factors and values around integrating general and inclusive language, gender neutral language, was really important to reflect in the New York City Charter. In addition, we recommended that the role of Chief Equity Officer is made permanent, not only in city agencies, but also as a lead role in the administration. Either as a deputy mayor or a senior director in a mayoral office. In addition, really creating ways in which community partnership and decision-making can happen in a more inclusive way. And so establishing a tripartite system that really allows for community members to inform neighborhood planning processes, budgeting decisions going forward. And so many of these discussions are still happening. And as I've mentioned earlier, we look forward to collaborating with the commission on additional health equity recommendations. And so with that, I'll end there and open up for any questions from the board.
Thank you so much, Dr. Sterling and Morse. I want to just take a moment to express my gratitude to both of you as leaders at the health department for shaping this work and for allowing us to stay true to the idea that this was a resolution beyond a declaration with very tangible actions tied to them. I have to comment for the board on the fact that this has unleashed a wave of momentum and work across our health department. And you can see from the examples, particularly of CIRCA and the work with the Racial Justice Commission, in the ways in which we're seeking to catalyze that same sense of momentum across the city and across institutions. So thank you so much to both of you. And we'll open it up for brief comments and discussion. I want to underscore the request for us to stay brief here because we do have one more section of the agenda that is important for us to cover. And I'll yield back to Dr. Easterling, who will help to moderate and field questions in this section.
Dr. Richardson, I see you here.
Thank you, Dr. Easterling. So in deference to Dr. Chakshi's request that we be brief, I'll eliminate the 2 minutes of glowing accolades I was planning to give you and Dr. Morse and the department for initiating this effort, and just get to my fairly specific question. You mentioned that you had just received actually some data from NYPD, and I was wondering, is that about injuries of people in police custody? Is it about officer involved shootings? What actually is the nature of those data, which have been sort of a longstanding interest of mine?
Really good question. Thank you so much, Dr. Richardson. I'll just make the point to note that this is the work that the agency has been working on in collaboration with NYPD. This initial tranche of data is really looking at law enforcement related deaths for NYPD. This has been a good collaboration with the first deputy commissioner and the commissioner. And so we're looking to expand to additional indicators. And so we'll be circling back to this group on that approach in the coming months.
That's great. I didn't know if that had continued. I'm very pleased to hear it's ongoing. Thank you.
Yes. Great. Dr. Redline?
Hi, thank you. And I really just do briefly want to say that this report is impressive in every way. And I look forward to hearing more about the reports that you develop going forward. I had two specific kind of questions or comments. In the section where you talked about looking at the health code, and the language and the racism embedded in some of that. I'm particularly pleased that you have focused on school health. I think understanding the impacts on children early on in terms of what is identified and what is understood from early health reports is critical for addressing them appropriately. And I'm just wondering if you have any particular early areas of focus relative to school health and to children in that code.
Yeah, no, it's a really quick question. I appreciate it. What I can say right now, because we are still conducting that review for the health codes, I think the important part here is really looking at the process, because this is the first time we're doing it. And I would also say that other jurisdictions are not conducting this type of review. And so we are developing a novel way of looking at our health code and using racial equity assessments to tailor it to ask the specific questions. Are we really engaging those who are most vulnerable? What are the resources that are really needed? And are we making sure that the systems are in place to do the things to reach our public health goals? And so I think that's really important. Now, we are really focusing initially, as you mentioned, on school health, more specifically childcare. So I think we're going to learn more as we complete the review and expand to really refine our tool. I'm sorry that it doesn't really get to your question right now, but we do look forward to providing an update to the full board on how the review of the health code goes.
That's excellent. Thank you. And the other area under the Racial Justice Commission and what you talked about, the 17 recommendations, I'm wondering if you have in mind, or they have in mind, or the collaboration has in mind, reaching out to the federally qualified health centers that serve communities, with fewer resources than others. They are often run by and overseen. Their governance is by community boards, and and their focus is on social determinants of health. And there may be some institutional and community-based knowledge that would be beneficial to tap into.
Yeah, we certainly agree with that value point, and we want to just lift up that our engagement processes always include many of our FQHC leaders across all the different initiatives that we do. And so we're certainly in touch with many of them. There will be an opportunity through the commission as they'll be doing ongoing engagement leading up to the November 2022 ballot. So we'll certainly take that point back to the commission and make sure that we're incorporating our FQHC leaders as well. So thank you so much for that.
Thank you.
Dr. Gill? Oh, sorry.
Forgive me. I just wanted to jump in with one more brief comment on Karen's really thoughtful point about FQHCs, because we also believe strongly in them as a backbone, for our health equity and our racial justice work. I wanted to point out that the Public Health Corps that we announced earlier this year includes FQHCs as a core pillar. Public Health Corps is being led by Dr. Morse and her division, and they've been very deliberate in ensuring that that's a key part of our commitment to anti-racism in the Public Health Corps.
Thank you. Thank you for that information.
Dr. Gill?
Thank you so much, and congratulations. I think that this is really groundbreaking in terms of acknowledging such a important impact of racism on public health. My question or comments is, as we look further, and by the way, I agree with Karen, I'm very pleased to see the focus on school health and early childhood and all that. But I was just wondering, as we develop this further in the area of behavioral health, because that's an area that sometimes we don't really focus, and real concerns, at least from ethnicity as well as race, the issues of diagnosis in that whole area of behavioral health, both for children, adolescents, and adults.
Well, I'll start, and I'll also turn to Dr. Morse to see if there's anything she would like to add, particularly around the coalition. But I'll just say again, this is another area that we deeply believe in, really making sure that we are connecting both the physical and mental health in the work that we do, thinking about our population health goals. So I would just say that the ways in which we're thinking about these actions, and certainly welcome any additional examples of ways in which we can strengthen it. We're going to continue to expand on our actions, and we're working with all of our divisions across. So certainly figuring out how we're pulling in more of the behavioral health language and thinking about that going forward will be really helpful. You will hear really shortly, certainly, the work that we're trying to do to make sure that we're supporting neighborhoods across to address the crisis related to opioid overdoses. And so we tie this back to our resolution, because we see this resolution as being foundation to the core work of this agency. And we're going to continue to do that. How we roll out our place-based efforts, how we're supporting our internal transformation, and any work that we do with other agencies, there are ways in which we can tie it back to this resolution as we continue to advance our anti-racism work. So I think those are going to be really important, that we continue to get feedback from this group. We are certainly engaging some external groups as well, and also working across our staff in the agency. Dr. Morse, I don't know if there's anything else that you want to add.
I really appreciate the question, Dr. Gill, and agree with everything Dr. Easterling shared. The only other thing I would just mention is that, as was just mentioned by the commissioner, in terms of our work with Public Health Corps, part of the community events and community health events that the community-based organizations and FQHCs are hosting as a part of Public Health Corps is really asking community members in priority neighborhoods that have had disproportionate impact by COVID around their experiences of anxiety, depression, loneliness, and doing some of that primary screening as a part of that work as well, and connecting them with resources. And so I do think it's just one other way that we are trying to make sure that behavioral health needs don't go unseen and are not made invisible, particularly in communities that have suffered from disproportionate impact from COVID. So thank you again for the question.
Thank you.
And with that, I do not see any other hands, but I just want to say thank you again to this group, because it was you all, your leadership, in making sure that we move forward on this resolution. And we're certainly committed to continuing to advance this work into the next administration. Oh, sorry, Dr. Kwan, I did not see your hand. Sorry about that.
I just, thank you. This has been so impactful, and all the work that has gone into it has been so inspiring. but you had mentioned Take Care New York, and this may be a premature question, but I was just wondering where racial equity or racial justice or structural racism will be embedded with the next iteration of Take Care New York.
Yeah, no, that's a really important question. And I would say in the next iteration, you will see it embedded throughout the document. We have made sure as we shifted from the previous iteration, and I think it was a really important step under the former commissioners for both Dr. Bassett and Dr. Barbeau to really embed a health equity lens. But you also will see a shift in how we sort of broaden the definition of what creates health. And really identifying those structural drivers of racial injustice in our neighborhoods across. And so it will not just be the language, but you'll see how we're really trying to take a closer look in key neighborhoods across the city and those structural drivers around housing, public safety and community cohesion, education, healthcare access, are many ways that we know are impacting the health of New Yorkers. And there's ways in which we can influence it, but also we can partner with city agencies across. So we certainly are looking forward to getting your eyes on it and so many others. And we're really excited about the direction that to Take Care New York, which we're calling a roadmap to health equity when we're releasing it. Okay, with that, thank you for all of the questions. Again, thank you for the time to provide an update, and I'll turn it back over to our commissioner.
Thank you very much again, Dr. Easterling and Dr. Morse, both for the presentation and the really terrific work. It reflects both amazing progress, but I think also gives us a sense for how much work remains. And we're really looking forward to partnering with the board on that and keeping you updated just as we did today. We're going to turn to our final item on the agenda, which is another one that I'm truly excited to discuss with the board. I will begin briefly on this item before turning it over to Dr. Michael McRae, who's serving as our acting executive deputy commissioner for mental hygiene. And before I dive into my slides, I did also just want to welcome Dr. Mitch Katz, who's joined us as well. Thank you, Mitch, for joining. And we can move to the next slide. So this item is on our proposed statement to take action to prevent drug overdose deaths. And, I want to start by grounding us in the sense of urgency and the truly profound gravity of the drug overdose epidemic, both in our city and across the country. Tragically, 2020 is the deadliest year on record for drug overdoses, both in New York City and across the United States. We had over 2,000 people, unfortunately, lose their lives just in New York City during that year alone, the highest number since we started measuring in the year 2000. And as always, we don't want to consider these as faceless numbers. People who die from drug overdoses are our brothers and sisters. There are our family members, our neighbors, and unfortunately, too many people are having their lives cut short by something that can be addressed with with the treatment options that we have available today. What we have done is had a concerted focus on this, even as we talk about COVID-19 response. One of the things that I've said is that if it were not for the fact that we were in a pandemic right now, this would be the 5-alarm fire in public health. And of course, we should still treat it like the emergency that it is. And so we have done a lot of work and thinking over the last several years, but particularly over the last 18 months in order to meet the sense of urgency that we feel about this epidemic. Next slide. A little bit more background in terms of our response, which is extended over several years here in New York City. We've been working, as always, in close partnership across public health, healthcare institutions, and community-based organizations, and focusing on these different dimensions of our response. I mentioned treatment, particularly focusing on buprenorphine and methadone as first-line treatments. A lot of this included shifting our work to be able to better care for people, including via telehealth and other modalities during the COVID pandemic. And overall, our approach has been one that embraces harm reduction because it is evidence-based, it works, and it is also about compassion and dignity for the New Yorkers whom we're serving. Some of those harm reduction efforts include the syringe service providers, whom we've been working in close partnership with for decades, but particularly investing even further in their services over the last several years. And then, as you may have heard, of course, November of 2021 marked the first publicly recognized overdose prevention centers in the nation to open up here in our city. And I'm really proud that we were able to take this step together with the providers that we're working with, who have to be recognized as not just courageous, but excellent in terms of the services that they have been providing to their clients and people who are our neighbors. We, with overdose prevention centers, the approach is to extend on that foundation of harm reduction that I've described, but I also want to draw some connections, particularly to what we just talked about with respect to anti-racist public health practice. Our approaches to addressing the overdose epidemic have to be rooted in equity, because of course the overdose epidemic travels along the lines of inequity that exist in our society. So we felt a deep sense of conviction in moving forward with overdose prevention centers. As I'm sure many of you know, there is a robust evidence base for them. Over 30 years of research, there are 100 overdose prevention centers operating across 3 continents. And what they show is unequivocal and clear. Overdose prevention centers save lives, they get people linked to care, and they improve conditions in surrounding communities, particularly when it comes to things like syringe litter and public drug use. So with that, I'm going to turn it over to Dr. McRae for the next slide, but just to pass the baton here in saying that this is something that we felt strongly about bringing to the Board of Health because there is more work to be done here. And we want to ensure that that this statement captures the voices and the sense of commitment that the Board of Health has at this moment as well. So with that, I'll turn it over to Dr. Michael McRae.
Thank you, Commissioner. Given what the Commissioner has just highlighted, we're asking the board to issue a formal statement that speaks to 5 specific pieces related to the work in addressing this issue. 1, a statement that endorses the health department's actions to prevent lives lost from drug overdose, including by continuing to support the operation of the overdose prevention centers across neighborhoods in NYC, expanding harm reduction strategies to respond to the overdose epidemic and promote the health of people who use drugs in New York City, including but not limited to the distribution of naloxone and fentanyl test strips, the implementation of drug checking services, expansion of syringe service programming, and provision of low threshold buprenorphine treatment, as well as ensuring widespread access to medication for opioid use disorder treatment. Next slide. A statement that requests that the health department report to the Board of Health annually on the health department's harm reduction efforts and initiatives, including the establishment of overdose prevention centers. 3, a statement that requests the health department and harm reduction providers continue to work together to educate the public and local leaders about the benefits that overdose prevention centers offer the community and lives saved. Next slide, please. 4, a statement that requests that the federal government and New York State provide authorization of such overdose prevention centers and continue to expand funding and support for harm reduction services and medication for opioid use disorder treatment. And 5, a statement that requests that the federal government and New York State further lower barriers to medication for opioid use disorder treatment by expanding access to methadone outside of opioid treatment programs, eliminating the DEA X waiver requirements for all buprenorphine prescribers, and making COVID-era provisions that allow the use of extended take-home doses permanent. Next slide. So with that, we open up the floor for discussion or questions.
Thank you so much, Dr. McRae. And yes, please raise any issues by raising your hand virtually or on the screen. Dr. Foreman.
Thank you, Dr. Chakshi and Dr. McRae. That was, this is a really important effort. I had a technical question that I had raised before with Lisa Landau, and I'll just repeat it here. In the last 2 recommendations, they're phrased as request. And I enjoyed reading the editorial that you, Dr. Chakshi, contributed to and co-wrote. And I wondered if the word urges the federal government and New York State to provide for both the last 2 might be stronger. It just feels to me that when the board requests of the department something, it's almost the department kind of has to do it. And I don't believe the board has the power to, make the federal government, state government do things, but the word urge feels stronger to me. But I defer to the legal expertise here, which one is better. But I just thought I would ask that publicly at the meeting.
Thank you, Dr. Foreman. And I think that certainly echoes the sense of urgency that you heard me speak to. And so I resonate with the spirit of it. But let me see if our general counsel has thoughts on that with respect to the verbiage itself.
Thanks, Commissioner and Dr. McRae and Dr. Foreman for your comment. I think it's really a question that there's not a legal issue in choosing one word over the other. So it's certainly has a different flavor to it. And I think that's something that we would have to decide is the right flavor today or not. So I appreciate your comment and look forward to hearing what others might have to say, but not a legal issue per se.
I guess I would just favor the strongest possible language that we can use in this setting, given the magnitude of the crisis.
Thank you so much. By way of process, maybe we can just invite a little bit of input from the other board members in terms of, if I understand correctly, for the last 2, it would be changing requests to urge with respect to the actions that are laid out in the statement. Karen, did you want to speak to that part of it?
Yes, thank you. Relative to those 2 recommendations about federal government and New York State authorization, maybe we could have an appropriate conversation about where things are relative to authorization currently, and kind of understand what we are trying to accomplish with this urging, and how important it is for the operating of the centers, for the approval at both state and federal levels.
Thank you. That's helpful. And I can start on that. But Dr. McRae, please chime in as well. I'll start with the last part of what you asked, Karen, which is to say, the 2 OPCs in New York City are operating, and we have no indication that that there would be any action at the state or federal level that would preclude their operation going forward. With that said, we do believe that this part of the statement is important for a handful of reasons, which I'll boil down to in terms of the sustainability and the scale of the approach. For sustainability, certainly having state and federal authorization is important so that other providers will consider moving in this direction, as well as the funding streams and the other ways that ensure longevity of the existing sites. And then in terms of scale, this is something that, again, we have to, as public health professionals, recognize that we are in a crisis right now, and it will take more action than what we have started to be able to meet this problem at scale. And state and federal authorization, we believe, will help with that, not just in New York City, but across the country. So I hope that is somewhat helpful in clarifying where we stand. The last thing that I'll say, because you asked also about where the conversations stand, I'll say we've had productive conversations about this with health counterparts at both the state and the federal levels, but that has not resulted in authorization, in a written way, in the way that we think is warranted, given the importance of overdose prevention centers.
Thank you. That helps provide a context. I support using the word urge. It sounds more, more important, more timely.
Thank you. I saw Dr. Richardson's hand next.
Thank you, Dr. Chakshi. Yeah, I think that provided helpful context. I also support Dr. Foreman's suggestion to change the word request to urge. And I have to admit, I have some trepidation about the request or the urging to provide authorization. I hope that's what we're moving toward, but as I previously voiced this opinion, I would be content if they simply left them alone. For those who may not be as aware of this issue, there were real questions about criminal prosecution of providers and staff who worked at such centers under the previous administration. There's still certainly a legal interpretation to be made about the illegality of activities at these centers, as well as misgivings for those who are licensed medical providers about whether their license would be subject to suspension or revocation due to professional misconduct. So this is still a very risky undertaking for people who actually staff these centers, because there are many avenues for those who wish to suppress this kind of programming to use against people who work in them. So the jump from it was nice just to sort of have some reassurance that there would be no criminal prosecution without the leap to authorization seems like a big leap to me. But if this is where your conversations are, for those of you at the health department, and you think this is the right position to take at this time, I'm willing to to be sort of pushed out of my comfort zone. But the reality of where we are in terms of the legal and sort of organizational governmental infrastructure to pursue these programs and expand them in the way that is really needed to meet this emergency. We are so far from there. This puts New York once again way out in front. And I think it's the right thing to do, but I just wanted to provide a little bit more context about how extraordinary it is that this is a conversation we're even having at this point in time.
Thank you so much for all of those really thoughtful comments, Dr. Richardson, and a lot of resonance among those of us who have been working to push this forward. I will say for my part, I do feel strongly about the authorization language for the reason that you concluded with. We have to recognize this as a crisis with urgency, and we need all levels of government pushing forward with the tools that we have at our disposal. It also, your comments also give me a chance to echo you in acknowledging the real courage of the providers that started this work. They're known as On Point NYC, and particularly Sam Rivera and Kaylin C. At On Point, who have demonstrated not just courage, but professionalism and profound dedication to the people that they've been serving for years in these communities. Thank you. I see Dr. Gill's hand up as well.
I just wanted to underscore that this is in the years of practice that I have in this area. I think that this is a crisis, it's even beyond a crisis. I have never seen the numbers that we are seeing now. And I understand, Dr. Richardson, you're very, the concerns that you express. And, we have colleagues that really have been on the trenches for years doing this type of work. And I feel a sense of protecting them, although quite frankly, for years, they have been up there doing this work. I do support Dr. Foreman's recommendation of putting this in urgent terms, because this is beyond, for me, this is more than a crisis. I don't know what to call this. But we really need to make sure that the federal and the state level understand really what's happening on the grounds here. This is just beyond.
I agree with you, and thank you for those comments as well, Dr. Gill. Let me take one more pass to see if there are any other comments or questions. Right now, I believe that the change in language that we have on the table is to change the last two requests that began those points to urge. Okay, well, thank you very much. Since there are no further questions, I will ask for a motion to issue a statement of the Board of Health to take action to prevent drug overdose deaths as amended with respect to those two word changes proposed by Dr. Foreman.
So
May I have, thank you. Thank you for the second. And I'll now take a vote from each member. Dr. Joel Foreman.
yes.
Dr. Rosa Gill.
Yes.
Dr. Mitch Katz.
Yes.
Dr. Susan Klitzman.
Yes.
Dr. Simona Kwan.
Yes.
Karen Redliner.
Yes.
Dr. Lynn Richardson.
Yes.
Thank you very much. With a unanimous vote of all 8 Board of Health members present, the motion carries. Okay, well, that brings us to the conclusion of our agenda. Thank you. We know this was a busy meeting of the Board of Health. It is a busy time for us. I'll just end on the brief note to say that, as all of you well know, the different things that we talked about today, from COVID-19 to racial equity to the overdose crisis, they are all inherently connected. And one of the things that we have strived to do at the health department is to recognize those links, to address them in nuanced ways, but always move toward action in addressing them. And the Board of Health has been a terrific partner for us, challenging us, pushing us in many ways, and supporting us during this time of continued public health crisis. So as always, I'm grateful. And I personally just want to wish everyone happy holidays not quite the holiday season I know that many of us were hoping for or looking forward to, but I wish you joy and reflection, and here's to healthier and happier 2022. Thank you so much.
Dave, if I could just say, because you and I work together every day on this crisis, what an amazing job you're doing, what an amazing job you've done, how great your staff is. Dr. Easterling has been a phenomenal partner for us, how well I think health and hospitals and DOHMH have worked together around the crisis and around the testing. And there's so much, to be proud of the work that you've done and that your department has done, and what a privilege it is as board members to be part of it and to support you. And just thank you for, I'm sure board members know, but Dave is on calls at 11 p.m. and 1 a.m. and 6 a.m. and he's out all over the city along with his staff and really doing just a phenomenal job. Thank you.
Thank you, Mitch. I really appreciate those words. And as I know you'll echo, we get to be at the helm of these amazing teams, people who have moved mountains over the last 2 years. And so all credit to them. But
Absolutely.
Words are very much appreciated. Okay. Thank you so much to the board.
Thank you.
Thank you and happy holidays.
Happy holidays.
Safe holidays.
Safe.
Thank you.